Hi, my name is Samantha and I'm a physiotherapist with a special interest in women's health, and I'm also trained as a pelvic health physiotherapist. Today we're going to talk about body composition changes during menopause and which exercises have been found to be the most effective in reversing these changes or preventing them altogether. So body composition changes normally start happening 3 to 4 years before you hit menopause. So it's suggested that we start these exercises in our 40s, and in this way, when you start going through perimenopause and menopause, you might prevent having these body composition changes. Hormone replacement therapy can be a good adjunct to making these changes, but chat to your doctor. Hormone replacement therapy can't stop the changes and they can't reverse the body composition changes, but what they can do is slow them down. So maybe while you're making changes in your lifestyle, you could use it to slow some of those body composition changes down. When we're looking at what's driving those body composition changes, if I simplify it into 4 different things that happen to us, our blood glucose levels become very uncontrolled. We have a drive to store subcutaneous fat. So there's typically a lot of weight gain, even though you haven't started to eat more or do less, specifically around the abdomen. There's also decreased bone density, so you might get diagnosed with osteopenia or osteoporosis at some stage. And there is also difficulty building lean muscle mass. So our muscle protein synthesis is impaired. There's a pathway that we used to use to build lean muscle mass that's no longer available to us. And so there's a physiotherapist called Stacey Sims who's written a book called Next Level, and she's got a trifecta of exercises that she's found in research to be the most effective. And I'm going to go through those with you now. If you want more information, I suggest having a look at her book. So if we're looking at the trifecta of exercises that she recommends, the first one is high intensity interval training or a HIIT workout. And what that looks like is 20 seconds of full gas, getting at everything that you have, then 2 minutes rest, and you do this for 20 minutes. The suggestion is that you do this to start with twice a week, build up to 4 times a week. The other exercise is heavy resistance training. So this is picking up heavy stuff. If this is new to you, I suggest working with a personal trainer to just teach you the types of exercise that you do with weights and to make sure that your form during the movement is good, while also giving you a heavy enough weight that it is working you at 90 to 100% of your capacity. So it isn't as helpful to do something at 70% of your capacity at this stage of life. So it'll be low reps, maybe 5 repetitions of an exercise, lifting a heavy weight, and then maybe 4 sets or something like that. So try and get guidance so that you don't hurt yourself and that you start where you are, because what's heavy for me is going to be different to what's heavy for you. Someone might lift up 5 kgs and that's heavy, and someone else might be lifting 60. So start where you're at. And then the third exercise is plyometrics. So this is jump squats, jumping lunges, and it's really good for building that bone density up, as well as the fast-twitch muscle fibers, which we really lose during this phase of life. So if you are an athlete and you're really looking for that speed, then plyometrics is a nice way to get it. If you need to choose between the 2 forms of exercise, 2 to 3 days of heavy resistance training and plyometrics is more bang for your buck than just the 4 days of HIIT workout, because you get more of that bone density improvement with the other 2 forms of exercise, whereas with the HIIT it's not really targeting that so much. But if you can do everything, you'll obviously get a bigger response and maybe a quicker response in body composition change. The other thing to note is, because we can't use our normal pathways to build lean muscle mass, once you've done the exercise, within 2 hours you need to have free amino acids available to you in the body to create the lean muscle, which means you need to have protein within 2 hours of your workout. So this can be a protein shake or eating protein, but just to note that if you've done the exercise and you haven't had your protein, you are not going to build the muscle. It's not possible. So you need to combine those two. And don't worry about becoming a bodybuilder and having big muscles that you don't potentially want. It's really difficult this time of your life, and that's why we have to do so much just to get a little bit of muscle. So don't panic about that. Thank you very much for listening, and I hope that this whole series is going to be helpful for all of you. And please, if there's any questions, ask us, pop it in the chat, message us. We're all very willing to answer anything.